Welcome to the Vanderbilt Eye Institute's Audiovisual Retinal Atlas. This presentation is on the dome-shaped macula. This entity was first described in 2008 by Gaucher. It can be considered as a type of macular degeneration as most patients are moderately to severely myopic. Instead of the usual geographic atrophy that you normally see in myopic degeneration, the findings are much more subtle. Let's look at some of its characteristics. The prevalence of a dome-shaped macula varies from about 20% in Japan to 11% in Europe. It is characterized by a convex bowing of the macula towards the vitreous. Gaucher found it to be in myopic eyes with refractions of greater than -6 diopters. In a retrospective study by Lorenzo in 2017, he found that in myopic eyes referred for blurred vision, 50% had a dome-shaped macula and a refraction greater than -6 diopters. He also found that 52% of those eyes also had subretinal fluid, but whether or not they had subretinal fluid, there's no difference in the presenting vision. Here's an example of a patient with a domed macula. This is a 54-year-old engineering professor who has had decreased vision for many years. The refraction in the right eye was -18 diopters and the left eye was -13 diopters. At his initial presentation to the Eye Institute several years ago, the vision was recorded as 2400 in both eyes. He had an early cataract as well as the posterior findings, which you'll see on the next slides. Here's a photograph of this patient's right eye. There's a subtle myopic crescent at the nerve, and other than a slight mottling of the pigment epithelium, the fundus photograph and the retina looks fairly good. The fundus photograph of the left eye shows a little bit more of a crescent around the nerve, and the pigment mottling is a bit more obvious. You might be able to see the choroidal vessels a little bit better inferiorly and temporally, but there's really no other signs of how myopic this eye is either. The fundus autofluorescence of both eyes showed mottled hyperautofluorescence centrally in each eye. Here's a mid-phase photograph of the left eye. The retinal vasculature system looks good, the choroidal system looks good. You can see the subtle changes of the myopic crescent, and there's also hyper and hypofluorescence in a modeling pattern centrally. Now, this has taken about 2.5 minutes, and this could be window defects, but there's certainly no sign of any subretinal nevascularization or pooling at this time. Here is a later phase of the angiogram in the right eye. This one is taken at 5 minutes 45 seconds. Again, there's fairly normal retinal arterial and choroidal filling. Centrally, there's hyperfluorescence. It is not in a pattern that one would associate with either choroidal or subretinal nevascularization, and there's certainly no sign that there may be any pooling of dye from a central serous pattern. Now here are two OCTs, and we'll show you another one later. And this is important. The top one is actually before the prior photographs and angiograms, and it shows subretinal fluid, more so right eye than left eye, and maybe a hint of a dome, but I wouldn't say that this is really prominent. Now, a year later, on the bottom OCT, you can actually see the subretinal fluid in the right eye is about the same, but the left eye is more than it was in 2011. Well, this patient disappeared for a while, and several years later, he had cataract surgery. The vision improved to 20/80, but no better, and the anterior segment surgeon referred him on to the retina service to evaluate why the vision was no better. Before we go to this patient's latest OCT, we'll review the OCT findings in the domed macular condition. The OCT findings usually show a thin choroid. The sclera is very thick under the fovea. The shape of the dome can be different in different eyes. The dome can be round, or it can be elongated horizontally or vertically. Therefore, both vertical and or horizontal scanning is in order for these patients. Here is the OCT of our patient taken 6 months after the cataract surgery and when the patient arrived at the retina service. The white arrows show just how thick the sclera is under the fovea. The OCT also shows that each eye does have a slight amount of subretinal fluid, and if you compare this with years before, there's actually less subretinal fluid than previous. The dome is much better visualized with this OCT than with the style of the OCT taken several years ago. Lorenzo treated some of his patients who did have subretinal fluid. His treatments included low fluence PDT in 8 patients, Avastin in 7 patients, and Lucentis in 4 patients. He did not comment whether the fluid had resolved with the treatment, but he did find a year later that there's no visual difference whether the patients were treated or observed. In summary, be aware of the entity of a domed macula in highly myopic patients, especially if the refraction is greater than -6 diopters and they have blurred vision. Also remember that the changes may be just subtle RPE changes without other areas of myopic degeneration. So it would be necessary to take an OCT and look both vertically and horizontally. The differential diagnosis for subretinal fluid would include central serous choroidopathy, myopic choroidal nevascularization, or some of the other rare pathologies such as hemangiomas, uvula effusions, or posterior scleritis.